We will be starting our sedation process with our patient. This is Hercules. To start, I will give a sub-Q injection or a subcutaneous injection of atropine, and this will start our process. To give a subcutaneous injection, I will pick my locations. I'm going to go for a shoulder because that usually has more skin. And then I'm going to tent the skin and give the injection in the tent, so that way I'll be be parallel with his body instead of going in at an angle, because then I might accidentally pierce a muscle or a vein. So this is my atropine 0.15. I'll tent the skin. I'll insert the needle. I'll pull back to make sure I don't get a flash of blood, and then insert. And that's it. Okay, so our patient has calmed down a little bit, so we're gonna move forward with our process. We're gonna do our IM injection. So for this, we've pulled up 0.1 Dexam, 0.1 butorphanol. It's in the same syringe. For my IM injection, I'm gonna use a back leg this time. And so I'll give the injection near the lateral thigh region. And so I will go in at a 45 degree angle into the muscle, pull back again on my plunger, and then inject. And then we'll give him a couple minutes and we'll follow up with our induction IV. Okay, so now we are going to follow up with our induction with some propofol, and we'll give this IV. We've pulled up 1.5 cc so far, but we likely will not give all of this. We're just going to give it to effect until our patient loses most of his reflexes. So I'm going to use a cephalic vein. I've shaved a little window here so I can visualize the vein better. I'm going to apply some alcohol also to help visualize the vein and sterilize my area. And then I'm going to, once I find my vein, I'll insert my needle bevel up. Until I get a flash of blood, I'll have my restrainer release, and then I'll slowly give the drug. So we'll check some of his reflexes. We'll check the corneal reflex. If you tap here, they shouldn't really blink, and he's still blinking a little bit, so we're gonna give a little more. They also start to lose their writing reflex when they want to write themselves. So if you, if you stop supporting them, they'll try to fall down. So he's lost his reflex there. We'll check his jaw tone also. Make sure he's relaxed. So pretty relaxed there. And then the last reflex that I'll check is the withdrawal reflex. So if you give a little pinch on their toes, if they don't withdraw their foot back, then they've lost that reflex also. So he seems like he's in a good plane of anesthesia, so I'll pull out, recap my needle, and now we're ready to intubate. Okay, so now we are going to intubate our patient. He's at a medium plane of anesthesia now, so he's ready to be intubated. The first thing I will do is test my tube. And so I'm going to inflate our cuff. And you want to see this part of the cuff down here fill with air and hold steady. You don't want to see any deflation at all. And it's holding, so we're going to take this air back out so that we intubate with a deflated cuff. I know that this is a good estimate for my cuff because the diameter of our tube is roughly the same as the distance between his nostrils, and the length of the tube runs from his teeth to the point of his scapula. So I'm going to get ready to intubate. I have my laryngoscope here. My restrainer will hold his head for me. I'll pull the tongue out and use my laryngoscope to visualize here. I want the epiglottis to be down, so I'll wait for the soft palate to move out of the way. The larynx is open. I can visualize the trachea, so I'm going to insert it. Okay. I'm going to tie this around his muzzle. Hook our patient up to oxygen. And then I'm going to inflate my cuff so my assistant will breathe for me. And I should hear an audible leak because the cuff is deflated, so you can hear the leak. So I'm going to slowly inflate it until I don't hear the leak anymore. a leak would mean that the cuff is underflated. But I want to stop right as soon as I don't hear it anymore. I don't hear it anymore. That way I don't overflate the cuff. So we'll turn our patient onto gas now. And then I will lubricate his eyes. And we're ready. Okay, so now I'm going to express the urinary bladder on our patient before we prep him for his surgery. So I'm going to go ahead and isolate his bladder. Once I do, I'll slowly push with some pressure so you can see that he's dripping a little bit of urine. Okay, he's emptied his bladder, and so now we'll prepare for surgery. Okay, so now I will clip and clean my patient, prepare them for surgery. He's going to be having a gastrotomy, so we'll be making the abdominal incision. So I'm going to shave right in the middle here, go up to the xiphoid process, and then make sure that we get good side margins. Once I've got everything shaved, I'm going to vacuum all of the excess hair out of the way. For the scrub, I'm going to put some gloves on. We're going to be using chlorhexidine scrub and alcohol. So we're going to make 3 passes. But if your patient is dirty, you can do it 10 times and that would still be okay. So we're going to start with the scrub. We're going to start where the incision is going to be. And then we're going to work our way outwards, so that the most sterile is in the middle. And then we'll follow up with our alcohol. Repeat the same pattern. Do our last one, a minimum of 3. Okay, and now our patient is ready for transport. Now we're going to transport our patient to the surgery suite, so we're going to take him off gas, disconnect him, and then we will carry him, taking care not to contaminate the surgical site. And we'll connect him to this machine. And then we will tie him to the table. And now our patient's ready for surgery. Okay, so now we are monitoring our patient under anesthesia. So we have an anesthesia log prepared for him. So this is where I'll be documenting everything. So we'll write the time. And then on our anesthesia machine, we have some values, but we don't trust this completely. We're gonna want direct contact so that we ensure that our machine is in the right ballpark. So for heart rate, our EKG is giving us a heart rate of 69. I'm gonna go ahead and verify that by listening to our patient and being careful not to contaminate anything. Okay, so heart rate of 70 is about right, so our machine is not too far off. Next, we will check his temperature. So we have this thermometer attached, and so it's giving us a temperature of 99.3. Our respiration is down here. Okay, and that is 60, but that doesn't look right, so I'm gonna go ahead and watch him breathe and get a better estimate. His respiratory rate looks like it's more around the 20-25 range. That's what we'll write instead. We also want to check his mucous membrane, so we'll come up here and check his gum color. So that's pink, and we'll check our capillary refill time, which is less than 2 seconds, so it looks good up there. So we'll write pink in less than 2 seconds. Our blood pressure is reading, right now it's a little low, it's 101/77. We'll increase our patient's fluid right here in just a second. SpO2 should read anything over 95, so it's reading 100. Our ISO percentage rate we want to keep track of at all times, make sure he's not too high or too low. So right now he's on 1.5%. Our oxygen flow rate is still at 1. And our thermal support, I'll just write our heating pad because we have that on to maintain body temperature during surgery. We also want to document the time that anesthesia started, which was about 4 minutes ago. And our intubation was 5 minutes before that. Okay, and then surgery is about to start, so we'll document time right now. And then I'll continue to monitor like this as our doctor performs surgery. Okay, while he's under anesthesia, we'll also be monitoring the ECG here, and so you can see it reading as the patient's heart beats, and so this lets us monitor the patient's heart rate and heart rhythm. Right now the heart rate is about 70 BPM or beats per minute, and each interval in between the QRS complex is equal, so that means he does not have an arrhythmia. You want to make sure that you see all of the points of the complex, so the P wave at the beginning, the QRS complex, and then the T wave at the end. So all of that's present in this ECG strip, normal heart rate and no arrhythmia, so all looks good. Okay, so now I will place an esophageal stethoscope. So to do this, I have lubed the cuff already, and so I'm going to start by lifting the mandible and the tongue out of the way, and the esophagus is located up and to the left, so since this patient's in dorsal recumbency, we're going to go down and to the left, but we're going to pull the esophageal thermometer out. We'll insert here, and we'll pass through until we're nice and deep in there. And if you meet resistance, you can pull out a little bit and reposition. And then we'll auscultate and see if we can hear the pulse. Okay, and once you've located your pulse, you're good to go. Okay, now I will demonstrate performing CPR on a canine patient. Before performing CPR, you want to make sure that your patient is in cardiopulmonary arrest, and you want to make sure of that before you perform this. So to do that, I need to check if my patient is responsive. They need to be unresponsive. So if I pat on them, call to them, and they're not doing anything, they're unresponsive. And then I need to make sure that they're not breathing. So I will watch their chest wall, and if it's not rising and falling, they're not breathing. I'll also listen for a breath. If I don't hear anything, they're not breathing. So my patient is unresponsive and they're apneic. So what I will do is check their airway, make sure that nothing is blocking the airway. If there's not, then we'll place an endotracheal tube and hook them up to our anesthetic circuit with a reservoir bag or an ambu bag if you have one available. Then we will test by giving the patient a breath and making sure that their chest wall rises and falls and that they can take a breath. After that, you will want to start your compressions, and so on a canine patient, you want to go to the highest point of the chest, which is usually around the 10th rib. You want to place one hand down and the other hand on top, and you want to be able to be up tall so that your arms are not bent, they're completely straight. And when you compress, you're compressing down hard. You're compressing a third to a half of the patient's body mass. So when you do your compressions, you want to press hard, and you want to press at a rate of 100 to 120 beats per minute. So you'll do 30 compressions and then 2 breaths. If you don't have a chance to intubate your dog and you can't get them up to an anesthetic circuit or a reservoir bag or an ambu bag, then you can give a patient a breath through the nostrils. You want to make sure that when you're doing that, you're holding their mouth closed so that none of the air escapes. So you would give a breath, watch the chest wall rise and fall, a breath, and then go again for another 30 compressions. So it'll look something like this. I'm counting to 30 in my head. And I want to make sure that I'm stable so that I'm not falling over the patient or bending my arms in any way. A breath, either through the nose or if you have an endotracheal tube, do your machine, and then 30 compressions, 2 breaths, back and forth until your veterinarian directs you to do otherwise. Okay, now I'll be demonstrating a surgical scrub in, and I'll be putting on my gown and gloves. So the first step is to just do a basic hand wash. So this is not me being sterile yet, but just kind of preparing for it. So I'll want to get my nails in between my fingers and then up to the elbows. And if you're wearing an undershirt for your scrubs, you don't want that to be pushed up to above your elbows too. I already have my cap and mask on. Okay, and then we just drop everything. We'll worry about it later. I'll break out my iodine scrub. And so this comes with a nail pick. So I'll pick under all of my nails first. And from this point on, anything considered below your elbows is not sterile. So you want to keep your hands and your arms up. And then we just drop everything, we'll worry about it later. And the scrub works better when it's wet. So we'll start our scrub now. We generally want it to be 5 minutes long. And so we're going to start with our fingernails. And you want to do 20 scrubs in general. And then for each hand, you want to go finger by finger. And you want to treat each finger as if it has 4 quadrants. So each side, the front, and the back. And you do the same thing for each finger. And so the fingertips are considered the cleanest part, and then all the way down to your elbows is considered the dirtiest part. So for each hand, we'll follow the same order. Do a thumb too. treat the palm of our hand the same way. So the palm, each side. And then the back of the hand. And you're not scrubbing so hard to where you're excoriating your skin, because that can bring bacteria to the surface, but we do want it to be nice and clean. Before I proceed down the arm, I'm going to do the other hand and repeat the same process. So you want clean to dirty, and our fingertips are the cleanest part. And if your scrub gets dry, you can always wet it a little bit, but you don't want to touch the sink, you want somebody else to touch it. Thanks. Because now you're sterile. And we'll repeat the same process. Okay, move on to the palm of your hand again. Okay, and then from this point we'll move to our arms, so we will treat it again 4 quadrants, all the way to your elbow. Okay, so I'm going to drop my scrub in the sink. We'll worry about it later. I'll have somebody else turn the sink on for me. And when I rinse, I'm going to have the water go from my fingertips to my hands and flow down the arm. And then move out. You don't want to go the other order. You can go into the water again, but you don't want to go back and forth while you're under the same stream. You don't want to shake your hand either. You just want to let the water kind of drip down your arm. Be careful not to touch anything. Okay, I'll have the same person turn the sink off. And then I'll move over to this pack here. This has been sterilized, so there's a sterile hot towel here. And so to dry, you just pat dry in the same order. Start with your fingers. And I'm just using half of the hot towel so that the other half stays dry for my other arm. So I'll flip the towel over. Do the same thing. I'll drop my towel. And then my gown is designed and folded in a way that when I pick it up, it's facing me already. So I can just put my arms straight in. And then I'll have somebody tie me in real quick. And I'm keeping my hands in the sleeves because we're gonna close glove. Because your hands are clean, but they're not technically sterile. The gown is sterile. I'm keeping my arms up also. You don't wanna let it hang below your waist. Okay, thanks. And then the gloves are already open also. So I'm gonna start with my left glove. And I like to put where the fingers are facing me. Oops, I'm sharp there. So that I can just grab it straight through here. Grabbing it with the sleeve. Okay, and then it can look silly. We're gonna do the other one and then we'll fix everything, but that way my fingers aren't touching this one. Okay, now that my fingers are completely covered and I'm sterile, I can then pull the glove the rest of the way down. And then I can fix my fingers so that I can use them. And the sleeve of the glove can be at your palm, or if it's uncomfortable, you can always pull that lower. Okay, and then at this point you're considered completely sterile, so you would want to keep your hands up like this, or just clasp them together so that you don't touch anything, and now we're sterile and ready for surgery. Okay, so now I'll be demonstrating draping a patient. I've already pre-cut a window out of my drape, so the window is there. So we'll take the drape, be careful not to touch anything, and then open it. And then when I walk it forward, I'll be careful not to touch the table with myself. And we're good to go. Okay, now I'll demonstrate blotting. So I have this gauze here that's already been moistened, and to avoid pulling away any clots, you don't want to wipe the tissue. Instead, you'll just kind of gently blot and moisten it that way. Okay, so now we will demonstrate moistening tissue during surgery. So I have the sterile syringe full of saline and then a sterile needle on top. So I'll decap the needle, and then from a distance I'll lavage the area while somebody else blots the tissue. And then when I'm done, I'll just recap my needle. Okay, so now I will demonstrate loading a blade onto a scalpel handle and then passing thumb forceps and hinge forceps also. So to load the scalpel handle, I'll grab the blade and some needle drivers and load it at an angle. And then the scalpel handle will slide in.
Scalpel. Thank you.
And then for the thumb forceps.
Thumb forceps, please. Thank you.
And then for hinge forceps.
Perfect. Thank you.
Okay. As a sterile assistant, your duties are to remain sterile throughout the whole procedure. And so what that would mean is keeping your gown on, your mask, your cap, and your gloves. Usually you want to hold your hands either like this or like this, clasped together, so that you're not tempted to touch anything and risk breaking your sterility. You also don't want to drop your hands below your waist, because anything below the waist is considered not sterile. When you pass people in the surgery suite, you want to pass back to back so that you don't risk anything touching the front of your gown or your gloves. If you do puncture a glove, you can always have somebody remove the gloves and put on a new pair, or you can re-glove over that pair of gloves. If you drop an instrument, you have the choice to use a different instrument. You don't want to reuse that one unless it can be flash sterilized. And then in that case, if you flash sterilize it, then you can reuse that instrument. But super important to always keep your sterile field by never coming into contact with anything. And if you do, you'd have to go through the whole process over again of scrubbing, gowning, and gloving. Hi, this is Madeline. I'm here with my preceptor, Dr. Lisa Hansen, and we're preparing for a neuter on a canine patient. So she'll be doing surgery and I'll be monitoring anesthesia.
Hi, my name is Madeline, and I'm taking part in a canine spay today, so the patient is prepped, and we'll be beginning shortly.
Okay, this is Madeline, and I am participating currently in a feline neuter procedure. This is our patient. His name is Essa. He's hooked up to gas, and he's hooked up to his anesthetic monitoring system here, as well as IV fluids. There will be somebody monitoring anesthesia, and then our doctor will be performing the surgery.
Hi, this is Madeline. Today I'll be taking place, or part of a feline spay, and so our patient's hooked up and ready to go, and we'll be proceeding shortly.
Okay, so now we are going to clean up our surgical suite a little bit after performing some of our procedures. So the first thing I'm going to do is I'm going to dispose of some sharps. We'll take our blade off of our handle, and we'll put that straight in there. And there's a needle over here also, so we'll discard of that. And then also that. And then when our sharps have been disposed of, we will put our tools into our disinfectant. So a couple other tools are already in here. And we'll show how to properly clean our surgical instruments in the next segment. But we'll leave those. We'll throw away any trash. And this will all go into the laundry so that we can wrap some more packs. And then I'm going to take our detergent / disinfectant, and we're going to wipe down most of the areas in this room. So we'll start with our table and get rid of anything that might have been left over from today's procedure. And then we're going to wash this whole mat. Make sure we clean the whole table. And then we'll clean our light fixture. Sometimes it can get a little dusty up here. Make sure that nothing falls down into the next procedure. Next, we want to wipe down our anesthetic machine. Which includes wiping down the reservoir bag. And then we'll take our anesthetic circuit off the machine, and this will get deep cleaned along with our endotracheal tubes afterwards. After we have wiped everything down, we'll take our trash out. This is just regular trash. Any biohazard trash will be disposed of in a different container, so that's in the back of the clinic. But you still want to wear gloves. So we'll place our bag. We've got quite a bit of hair on our floor, so we're going to sweep a little trash bin for the next procedure, so we're gonna dump this in a different trash container, and we'll take our trash to the other side of the door also. And then we need to mop the room as well. So this is just a demonstration of kind of a daily cleaning of the surgical suite. So we're removing all the debris from today's procedures, but on a weekly basis, you want to deep clean your surgical suite, which would include dusting of all the fixtures, wrapping of all the packs, which we'll demonstrate later in the video, emptying your carbs containers, how we clean our surgical instruments here. So I have a bin that's full of our antiseptic solution and some water, warm water. And so I'm going to take our dirty instruments, transfer them to this bin. And you kind of want them to be open instead of closed, so that way the solution can penetrate the whole instrument. Be careful of anything sharp, any towel clamps that can stab you while you're doing this. And then once they're in the solution, we'll let them soak for 10 minutes before we rinse them. Okay, so it's been 10 minutes of our tools soaking, so now I'm going to take them out one by one, and we're going to rinse any chunks that might still be on them from surgery. And so we'll put them under the running faucet, and we'll kind of brush them gently and make sure that they're super clean. And then we're going to transfer them into our instrument lubrication. And they're going to sit in that lubrication for another 10 minutes before we hang them to dry. Okay, so it's been another 10 minutes of our instrument soaking, so we're going to pull them out of the lubrication, and then we will hang them on this rack and make sure that they are completely dry before we begin to roll them into any surgical packs. Okay, so now we will assemble a surgical instrument pack. We have two different types of packs here at our clinic. We have German instruments and economy instruments. The only difference is the quality in the instruments. The German instruments are a little superior in that manner. But we're going to put together a German pack. So I have my instruments laid out here. So in order, we're going to have 3 mosquito hemostats. We're going to have 4 towel clamps. And we're putting in order from smallest to largest so it fits in the tray. We're going to have 4 Carmalt hemostats. We're going to have 2 straight Kelly forceps, 1 pair of Olsenhager needle holders, 1 pair of Mayo scissors, and 1 pair of Metzenbaum scissors. And then we're going to loop a snook hook through all of these instruments and lay them in the tray. And then we will add our scalpel handle, our Adson Brown forceps, and our rat tooth forceps. To complete the tray, we'll add some surgical gauze, a huck towel that's been lint rolled already, and a drape that's been rolled in a back and forth manner. And then we'll wrap our pack. So we'll go in with our first wrap, and this has been lint rolled already also to get rid of any hair that can contaminate. And we start the wrap in kind of a diamond shape, pull up at the bottom, and then curve in. And then we'll do the same thing for each side. And you want to kind of pull it tight as you're wrapping it. And then when you wrap over the top, you tuck this part in as kind of a little tab, so that when the surgeon is ready to open the pack, they just pull this tab and everything comes apart. And then we do our second wrap in the same manner. The reason we do 2 wraps is because the outer wrap, after it's autoclaved, can be touched by people who are not sterile, like surgical assistants who aren't gowned in or gloved or anything. But the inner wrap is what's going to be touched by sterile people only, so a sterile assistant or the surgeon. So we wrap the tab there. When the pack is complete, we'll put a tab of tape on here so that we can label it. So we'll label the type of pack it is. So this is a German. We'll put today's date and then initials so that people know who wrapped it. And then the last step is to put a strip of indicator tape on so that the strip will change color to a cocoa brown once it's been autoclaved and it's sterile. And that's how you wrap a pack. Okay, now I'll be demonstrating folding a surgical gown. And so to do this, I've laid out my gown on a table so that way it can be nice and straight and not wrinkled. I've also already lint rolled it. So to fold it, I'm going to bring in one side, and this is facing outward so that if you were the person, this is facing away from you. I'm going to fold one side in with the sleeve covered. And we're going to do the same on the other side. You kind of bring them in at the center. And then you fold one more time, like so. And then from the bottom, you fold in an accordion style. And then just keep these tabs available. And then we also have a hug towel that's already been lint rolled, and that way when the surgeon opens their gown, they have a sterile towel to dry their hands after washing them. And then just like the instrument pack before, we're gonna wrap it with 2 layers of wrap. So we'll do the diamond shape. And the idea is when they open this and they take their gown out, it's already facing them. So that way they don't have to move it around or risk getting it contaminated. And we're giving the same little tab so that it's easy to open. We'll go in with our second wrap. Again, these have already been lint rolled, so we're reducing any potential contaminants such as hair, lint, any of that. And you're pulling in as tight as you can. And then, just like before, we'll put a piece of tape on here. And we'll write gown, today's date, and initials. And then we'll do our last step, which is the strip of indicator tape to show if a pack is sterile or not. And that's it. Okay, so now I will briefly discuss our autoclave machine. An autoclave is essentially a pressure chamber that is used to sterilize and disinfect surgical equipment. So that can mean anything from surgical instruments to gowns, towels, drapes, you name it, but it's a sterilization chamber. The way it works is it has high pressure and high temperatures, and that's how it sterilizes our equipment. So it runs on distilled water only. So before you load your autoclave, you want to make sure that there's enough water in it. So we pour our distilled water into this reservoir up to the line. It might be a little hard to see, but it needs to be up to that line to run. Otherwise, it'll tell you it's running low on water. So to load it, we'll open the chamber door here, and we'll have a tray in there so that we can set our pack or our gown in. And so this is the gown that I rolled earlier. So I'll load it in here and make sure that it's not touching the back of the autoclave or the top, as it can get really hot and it might burn the fabric. We'll close the door here, tighten it. And then it has a couple different settings. Ours are automated. There's one for instruments and then one for gowns. The one for gowns runs at a length of around 30 minutes pressure is 15 psi, and the temperature is 121 degrees Celsius, which is roughly 250 degrees Fahrenheit, and that's how long it takes to sterilize that pack. Okay, so now we will talk about maintenancing our autoclave. So there are a couple different things you can do to maintenance your autoclave on a daily and monthly basis. On a daily basis, what you want to do is after running all of your packs and gowns, you want to wipe down every surface of the autoclave with a damp towel and some soap on it. So you want to wipe all the outer surfaces. And then on the inside, you want to take any trays out, wipe those down, and clean in here as well. Get every surface, including the top, the bottom, and each side. The inside of the door also. On a daily basis. On a monthly basis, you want to do the full maintenance of the machine, which requires draining all of the water out of it and then refilling it. On the first drainage, you want to put in your autoclave cleanser, and so we have Chamber Bright. So you open the package and you sprinkle it onto the bottom. And then I would start the machine and run it, and it would do a full cycle with just the water in it, no packs or anything, and so all of the cleanser would melt and clean the autoclave as it went. When it's finished, I would drain everything, so it's going to drain all the distilled water that's in the machine currently. So we'll have our tube, and then we just use this container here to drain the water into, but you're going to connect it here. You're going to turn your nozzle. Until it drains all of the distilled water out. Okay, so all the water has been drained out of our autoclave, so we're going to remove this tube and then close this latch back up tightly. And then we're going to refill the machine with our distilled water. It's very important that you use distilled water instead of just normal tap water. So we're going to fill our machine back up. Through the reservoir until it meets that line. Okay. I don't know if you can see the line very well, but it's met the line. It takes almost a gallon of water. It's okay. Then we'll recap it. And then we'll run our autoclave one more time with nothing in it, and then after that it should be ready to use again after being fully maintenanced. Okay, so this gown that we just put in has been running and autoclaved, and we've just pulled it out, and so this is how you can ensure that it's sterile, is the indicator tape has turned this kind of cocoa brown. So this is an indicator that it's been sterilized, so you wouldn't want to use any pack that doesn't have the strip on it. If you're not 100% sure, then you should always autoclave again anyway, but this is sterile and ready to use. Okay, now I'll be demonstrating a suture removal on a patient. What you want to make sure is that it's been at least 10 to 14 days before you do this, and so this patient it's been 2 weeks. But we also want to make sure before we pull the sutures that there isn't any redness, swelling, discharge, or bleeding, things that could indicate either infection or that they're not ready to be pulled yet. Down here, there's a couple sutures. Cut these out.
Reduce the amount of activity as much as possible. So in spite of your best efforts, he's going to want to do more and get more and more active. Yeah, so yeah, you're going to have trouble probably containing him, and that's a good
One
thing.
more. It's okay, baby. It's okay, baby.
Trying to reduce it, and as long as he's getting better and better, everything's good. If he ever stops using the leg, that's
Okay,
when we
and that's
want
it.
to know.